My question's for the Minister for Health. 86-year-old Maria was brought to Mildura-based public hospital recently with a suspected heart attack. Maria was left on a gurney in the hallway for 6 hours, waiting for a bed, without being afforded the comfort of any visitors to hold her hand and support her, even though her daughters and granddaughters were outside in the waiting room. Maria died later that night, scared and alone. Why are Victorians like Maria still dying in hospital hallways despite Labor's repeated promises to fix the health system?
Minister for Health.
Thank you very much, Speaker, and I thank the member for Mildura for her question. Firstly, can I extend my condolences to Maria's family at what is obviously a very distressing time. As has always been the case in this place, I'm not going to provide comment on individual cases, and I would suggest to the member for Mildura, if she is genuine in her concern, that she can approach me, as she well knows, just in my office or correspond with me, and I will ensure that we find out exactly what has happened. But I would say this.
Minister will resume her seat. The member for Mildura has a point of order.
On relevant, Speaker, the question was not about the individual case, it was about why Victorians are dying in hallways.
Minister was being... Sorry, Deputy Premier, on the point of order.
Well within rulings of the Chair, page 155, an answer is relevant if it related to the question's preamble, Speaker Lindell, and the Leader of the House was well within her rights, as she did, to console the family, first and foremost, which is what the preamble went to. And the Minister's only just been on her feet for about 35 seconds, so I urge you to be ruled out of order.
I don't uphold the point of order. The Minister was being relevant to the question.
Thank you very much, Speaker. I was asked about a constituent of the member for Mildura, and as I've already indicated to the House, I take these matters very, very seriously. And if the member for Mildura joins me in that seriousness, then she will share with me information outside this chamber and I will get a response for her.
Yes. Member for Mildura on a supplementary question.
Mildura-based public hospital has been crying out for a bare minimum 30 additional ED beds for years now. When will the government provide them so patients like Maria can be treated immediately instead of having to lie on a gurney for 6 hours?
Order. Minister for Health.
Thank you. Once again, I thank the member for her question. There are a lot of assumptions in the question, and I would make this point. Here in Victoria, we're the only state that continues to see all of Category 1 patients that present to our emergency departments immediately. Immediately. That is a fact that we are proud of. Yeah. We're the only state that delivers that. Again, my condolences are with the family, and if the member wishes to really
Minister
understand what's happening, then...
Manager of Opposition Business on a point of order.
Speaker, on a point of order, the Minister is debating the question. It was about, very narrow, about 30 ED beds, and when will they be provided?
Minister was being relevant to the question. Minister, to continue.
Thank you. I appreciate the opportunity to respond to this question. A couple of important points that the member made in asking the question. One was that she underlined that Mildura is now a public hospital, and that, of course, was as a consequence of this government who purchased the hospital back from the private
Minister's
providers.
time has expired.